name is HGU Lee, a professor at Handong Global University. Today, I'm going to introduce a topic, communicating during global emergencies such as COVID-19 with the case in Korea. There was an exponential increase in infections after the first positive case was identified in Korea on January 20. However, Korea is managing the COVID-19 crisis quite successfully. One of the successful factors in managing the crisis is an effective risk communication. The government rolled out a massive public information campaign on prevention measures against COVID-19. It has also conducted twice daily press briefings, updated its online information continuously, and sent out targeted messages to the public. Combined with the rollout of testing for COVID-19, the government's transparent communication could minimize the public's fear. Risk communication refers to the process of informing and persuading the public about the risk so that they will be able to perceive the risk accurately and make appropriate decisions about it. In an emergency and risk situations, people's life will be turned upside down, and many things that we have never thought before can happen to people. In particular, the current corona pandemics have a high rate of infection, significant morbidity, lack of therapeutic measures or vaccination. It spreads over most of countries in the world. People constantly feel nervous about catching the coronavirus. Many people are experiencing sadness, anxiety, and loneliness. People may be feeling anger about their losses related to jobs, finance, daily routines, and the health of their loved ones, and so on. Importantly, they can feel helpless because there is nothing they can do except being at home all the time. Thus, communicating about the risk in an appropriate way is critical to make sure that people perceive the risk in a desirable way and take appropriate measures. In this lecture, I'm going to share how the Korean government dealt with the COVID issues, focusing on its risk communication. In terms of the risk communication in Korea, our government is managing the crisis by emphasizing transparency and open communication. There was a massive public information campaign on prevention measures, just like other countries do. This picture is one of the posters the Korean government developed to educate for the prevention of infections. In this lecture, however, instead of discussing on the public campaigns, I will focus more on the principles of risk communication and how the Korean government followed them, because they turned out to be effective to tackle the pandemic in Korea. Basically, the risk communication in Korea follows the 6 principles of crisis and emergency risk communications developed by the US CDC. So let's start with the 6 principles of crisis and emergency risk communication. Crisis and emergency risk communication is incredibly challenging due to time constraint and with incomplete information. Accordingly, it is challenging to develop right messages based on the right information at the right time from the right person. These 6 principles used throughout an emergency can help you guide your messages to be clear and concise and hopefully actionable. The 6 principles of crisis and risk communications are: be first, be right, be credible, express empathy, promote action, and show respect. Let's talk about these principles in more detail. Be first. Infectious disease such as COVID-19 is influenced by time a lot. The sooner you take action, the fewer people will be infected. People need information about what they can do to keep them safe and to help their family members as quickly as possible. In an uncertain situation like COVID-19, people want information and search for information by themselves to understand the situation and to reduce uncertainties. People tend to remember and believe the first message they hear. The first message becomes the reference point with which people compare all other messages they hear later. Thus, it is critical to make sure that people have accurate information as the first one before rumors or misinformation start to spread. So it is critical to deliver the right message by an official organization first. In a 24-hour media environment that we live in, it's challenging to be the first. However, being the first does not mean that you need to be the first for every information in every channel. Just be the first for information that your organization is responsible for. For example, if your organization is responsible for public health information, then make sure that your organization should be the first to share the public health information. You or your organization may not have information yet. It can be true for COVID-19. Nobody has enough information. In such a situation, just share a bit about the situation and what your organization is currently doing, demonstrating that your organization is an authoritative and official organization for the matter. This way will increase the likelihood that the public stays tuned into your communication rather than accepting recommendations from other resources. According to the interview with experts in risk communications in Korea, Be First principle was the best kept principle among 6 ones. Experts said that the Korea CDC's daily briefings twice a day with updated information on COVID-19, continuous update on the CDC's website and social media, and text notification services were all contributed to providing information to the public as quickly as possible. The second principle is be right. This means that you have to share facts. However, it does not mean that you have to deliver all the facts right away. In an uncertain situation like COVID-19, there are many things you may not know yet. So often you may not have enough information. Your information may not be correct. Tell people what you know, what you don't know yet, and tell people what you will update the information as soon as more information is available. Sometimes you may share incorrect information. Do you remember the first principle of risk communication? It is to be the first. Being the first and being right can be challenging in many situations. If you make a mistake, quickly correct misinformation. Don't try to cover it up. Correcting yourself can build and maintain your credibility. Be credible. Tell the truth always. This doesn't mean you have to say everything that your audience wants to know. You will not have all the facts yet. Just be honest with the information that you have about the situation and you don't know about the situation as well. Transparency is the key to increase public trust. The available information will change, and sometimes the facts can change as well as more information is available. Then provide timely updates. Express empathy. In a situation like COVID-19, people have a fear, anxiety, and uncertainty. Acknowledge that they can feel fear and anxiety. Demonstrating empathy for people can help build their trust in your organization and in your communication messages by demonstrating that you really are there for people. How can we express empathy? For instance, say we are in difficult and scary circumstances. During times like this, all of us feel uncertain. That is, acknowledge emotions or feelings that people have. Unfortunately, compared to other communication principles, expressing empathy was not well kept in Korea. Based on an interview with experts in risk communication, I will provide a few examples of what the Korean government hasn't done well. First of all, COVID-19 is a highly uncertain issue, and people are anxious about it. And it can be a virtue for anxious people to generate and share rumors and fake news. Nevertheless, the government was not empathetic to the public's anxiety. Instead, it declared that fake news is a public enemy and warned that the government would punish distribution of rumors and fake news. The government failed to express its empathy and concerns for difficulties and feelings of the public caused by social distancing, postponed school opening, and personal economic collapse due to COVID-19. The government communication focused only on what to do to overcome the situation. No concern for difficulties and feelings of the public evoked anger among the public. In addition, the government's communication lacked empathy for COVID-19 confirmed patients and their family members. The government communicated transparently by disclosing detailed information about confirmed patient movement in Korea. However, it is questioned whether it was useful and ethical to make such details of individuals' daily life public. It has raised privacy concerns. The data about the infected people was so detailed that they could be identifiable. and it is evaluated the government was not empathetic to COVID-confirmed patients. The government communicated without considering the people's hatred, stigma for certain group of people. For instance, when confirmed cases were found at the Itaewon nightclub cluster, the patients were treated as criminals, especially by the media. The experts say that the government should have considered unintended consequences of their communication and respect people and organizations regardless of their status. It is evaluated that the Korean government communicated quickly and transparently, and it built up the trust. However, it is evaluated that government lacked expressing empathy overall, as I shared a few examples. Considering time constraint during the COVID-19 outbreak, perhaps some mistake might not be avoidable. However, I hope we can take lessons from the Korea's cases and do better. The next principle is to promote action. Provide clear information on how to act to avoid or to minimize infections and to protect their health. The actions should not be complicated. Something as simple as washing hands or wearing masks. Providing people with things to do can help people feel less anxious. It's not going to remove all the fear that they are feeling, but at least it can help them manage their fear because it restores a sense of empowerment. Finally, show respect. People affected by disasters may have lost loved ones. They may have lost their possessions, and they may have lost their daily life. In an urgent situation, communicators are also under enormous stress. So they often forget to show people the respect that they deserve. But it is important for communicators to help people in distress maintain their dignity. In particular, you have to show respect for people who are affected by the event. For example, people who are infected by viruses or people who lost loved ones. For conveniences and simplicity, in many countries, including Korea, we call them with numbers such as patient number 1, patient number 2, patient number 31, and so on. However, they are not just a statistic of a population that's been infected. They are individuals who were unfortunate to be affected by viruses. Consider they can be sensitive, weak, desperate, or sad. Communicate in an appropriate way for each target audience. Show your respect and concerns. Treat people in the way that you or your family members would want to be treated. I introduced the 6 principles of crisis and emergency risk communications. They are: be first, be right, be credible, express empathy, promote action, and show respect. In an emergency situation like COVID-19, these principles can guide you to develop the right messages in the right way so that your communication can increase the effectiveness. The right message from the right person at the right time is critical for risk communication. People will judge your messages based on what is said, who says them, and how they are distributed. From now on, I will briefly discuss on the messages, messengers, and channels with some examples of how the Korean government handled these components. Before you develop the message, it's important for you to know your audience. You must understand how people have been affected, how they perceive the COVID-19 risk, and how they understand information, and so on. Your target audience will have different characteristics and needs depending on each group's relationship to an event. They react to COVID-19 in different ways. As communicators, we should develop the messages for each target segment. For example, you may need to segment your target audience, such as infected patients and their family members, general publics, people who are at high risk, public health personnel and medical workers, children, the elderly, and so on. For instance, in Korea, the messages for the preventive measures were developed even for kids. Here is a video clip for kids delivering the take action messages such as social distancing and washing hands, targeting young children. This series of videos have been transmitted via YouTube. Although it is Korean, you will be able to understand the messages. So let's watch this video clip. So what do you think about this video? Did you enjoy? In addition, prevention tips were issued in different languages, such as Mongolian, Russian, Cambodian, Chinese, Japanese, as well as English, targeting foreigners living in Korea. The information you deliver should include the take-on action messages. Remember that your audience might not pay attention to your messages, or they might not understand your messages well due to their busy life, due to their anxiety, and their low literacy. So you have to start the first messages, which are extremely simple and easy to understand and simple to take on action. Do not use difficult scientific terms. They can obscure the critical information and lead to misunderstanding. Use the language and terms that people use on everyday basis. If you have to use scientific terms, use them, but be sure that you define and explain them. If necessary, additional details and background information can be provided after the simple initial messages. When delivering the taken action message, tell people what they should do rather than what they should not do. There are people who feel that their freedom was attacked and who want to be against being told not to do something. So it is better to say what to do. Positive action messages can help increase people's sense of empowerment and positive feelings. There will be situations in which you should tell people what they should not do. Then it is okay to say so, but then follow up what can occur when people not follow the instruction. For COVID-19, messages can be very simple and positive. For example, wear a mask, cover your mouth with your upper sleeve or elbow, not your hand when you cough. Wash your hands, stay home if you are sick. Ideally, the messages should be repeated. When repeated, people are more likely to remember them. They can be recalled better when people need to take actions. In Korea, taken action messages were everywhere, in the street, in the media, in the buildings, and in the transportation, etc. As time goes by, more information is available and situation can change. Accordingly, you may need to change your messages as well. In the beginning of the COVID-19 outbreak, there are so much uncertainties. You should avoid speculation. Making guess or assumption when sharing the information can be risky. It will ruin the credibility of you as a messenger. Communicate only what you know. Likewise, do not promise any outcomes or resources beyond what you or your organization can deliver. Stick to the things that you can. Second, using humor is dangerous. The public may use humor to deal with their fear or difficulties, but as an official organization responding in an emergency, we really need to be respectful. You should express the seriousness of the situation while showing confidence. Third, your organization is not the only one that delivers the messages. The public will hear the messages from various sources, such as medical communities, local governments, and so on. If different and contradictory messages from various organizations are delivered, the public will be confused. Rumors can be generated, and your organization will lose the credibility. You might not be able to control what other organizations say, but try to build relationships with other organizations and work with them to ensure that the messages from other organizations can be consistent with yours. Inconsistent messages from other organizations can be communicated. Then just stick to your messages. Do not debate on them. If you have trust, the public will trust your messages. Although you have to take action messages for the public, be careful not to be paternalistic. Although you have to show the authority at the same time, respect the public and show empathy with their feelings. Use personal pronouns such as we instead of the name of your organization, for example, CDC, so that the public feels that they are also taking the responsibilities to overcome the situation as a community. In an uncertain situation such as COVID-19, rumor is prevalent. Rumor is defined as unverified information. According to Airport and Fussman, rumor is a specific or topical proposition for belief, passed along from person to person, usually by word of mouth, without secure standards of evidence being present. Rumor scholars such as Boudia and DeFondro claim that rumors arise and spread when people are uncertain and anxious about a topic of personal relevance to them. That is, in an uncertain situation like COVID-19, people generate and share to understand the situation and find out ways to solve the problems they are facing. So rumors are more prevalent when there is lack of official information. In this sense, Sibutani called rumor as improvised news. Rumors as unverified information might be completely or partly true or untrue. However, rumors can be important information to people, in particular in uncertain situations like COVID-19. Because rumors can be untrue or incorrect, they can impede official risk communication, make the public more anxious, lead to undesirable behavior. The problem is we do not know yet about how to manage rumor effectively. Some scholars argue that an organization should refute the rumor explicitly. However, others argue that reputation can increase one's rehearsal of the rumor and strengthen emotional arousal, so that the impact of the rumor can increase as well. Thus, the best rumor management is to prevent rumor generation and spread as early as possible. Since rumors are improvised news that people produce in order to understand uncertain situations, if there is enough information available to people, rumor generation can be minimized. Thus, in order to minimize the occurrence of rumors, an official organization should communicate with the public quickly and transparently. There have been many rumors related to coronaviruses in Korea. In the case of a new infectious disease such as COVID-19, there are many areas that have not been scientifically revealed. It also threatens a person's life. And so the public's anxiety is very high. Accordingly, incidents of rumors may be inevitable. The rumors that were prevalent in Korea can be classified according to the motives of rumor generation. Here are some examples. First, There were a number of rumors that worried people created to understand the situation and find their own ways to protect themselves from COVID-19. For example, rumors such as eating a lot of vitamin C can help prevent COVID-19. Or we can use a mask by disinfecting it with a LED UV sterilizer. Infectious diseases such as COVID-19 have not been scientifically verified, so experts give different opinions, and such information may be rumors in the sense that the information itself is not verified. Such information may prove to be true or false over time, or may remain unverified even when time goes by. Statements such as chloroquine, a treatment for malaria, is effective in treating COVID-19. And when COVID-19 is suspected, you should not take painkillers containing ibuprofen, should be treated as such rumors. Some rumors were created and spread by media or political groups. For example, the information that in order to make the number of COVID-19 diagnoses appear to have declined, quarantine authorities are interfering with the diagnosis of COVID-19 was reported in the media first. This type of rumors was mainly related to the government policies and measures. Although there were rumors related to COVID-19 in Korea, however, it seems that their impact on individuals' behavior and life was not severe. According to interviews with communication experts, most of them viewed that rumors related to COVID-19 increased people's anxiety. However, they say there was not much serious holding or risky behavior due to rumors and fake news. The Korea Center for Disease Control and Prevention operated the COVID-19 website. In the website, the government not only informed the status of confirmers in real time, but also operated the Corona-19 fact-check corner on the main screen. The COVID-19 fact-check page dealt with 54 rumors in total from February 4th to the end of May. Considering that there are more than hundreds of rumors related to COVID-19, the rumors officially refuted by the Korea Centers for Disease Control and Prevention were very limited. In fact, the CDC did not refute all the rumors, but focused on refuting the fake news reported by the media, which were mainly about the government policies and measures. When refuting the rumors and fake news, the Korean CDC was transparent with detailed information and evidences showing that the rumor is untrue. For example, regarding the fake news that the government is treating medical staffs badly, the fact-check site is clearly stated that it is not true, with the legal and policy grounds and background information that might have led to this fake news. It also explicitly states how the medical staffs are actually compensated for their work and efforts, and in what environment they work, and so on. More importantly, we believe that the CDC's quick and transparent communication helps to manage rumors effectively. In particular, the CDC's regular briefings twice a day and releasing data on the confirmed cases travel log helps to control rumors and fake news. Although the government did not respond to every rumor shared by the public, by communicating risk information quickly and transparently, it acquired the public's trust, and the public relied on the official information delivered by the government rather than rumors and fake news. Successful communication really comes from the credibility and trust can be built up when you communicate transparently. We reviewed very basic principles of risk communication in uncertain situations like COVID-19. Be first, be right, be credible, express empathy, promote action, and show respect. They may sound easy and simple, but in reality, it is not that easy to implement. In addition, I would like to emphasize that they are basic principles. But in each country, the communicators should consider unique challenges and situations around the issue. For example, cultural differences in communication management should be considered. For example, compare these two messengers, one in the US and the other in Korea. In the US, the spokesperson's confidence matters. But in Korea, rather than confidence, showing working hard to protect the public matters more. Understanding your audience's background, their level of scientific knowledge, literacy level, and risk perceptions of COVID-19 is critical because these will affect the public's understanding and perception of your messages. For example, if you are talking to people with a low literacy level, pictures than text would be more useful and understandable. Overall, it is evaluated that the Korean government managed COVID-19 and communicated with the public effectively. However, this did not occur one day. We learned through tough and painful lessons from an outbreak of the Middle East respiratory syndrome in 2015. Mr. Bon Dok-chol, director of the Korea Health Industry Development Institute, mentions. During the MERS outbreak, the government received severe criticism for its uncoordinated responses to the outbreak and its unpreparedness. Since then, the government made major changes to its public health emergency response framework, including risk communication. The government set the roles of national and local government, public health, and industry sectors in the event of another outbreak, so that the efforts of each organization can be coordinated and result in synergistic effects. Despite the fact that the prompt and transparent disclosure of information is the first principle of risk communication, the Korean government at that time adhered to the principle of non-disclosure on the hospitals infected having the MERS outbreak. 15 days after the confirmed MERS outbreak occurred, the government released information about the hospital where the first confirmed patient occurred. Later, due to negative public opinion of the government's closed-door policy, information on MERS hospital was fully disclosed. However, it was after the government already lost their trust from the public. The government's secret policy on the MERS hospital information has resulted in an increase in people's fear of MERS. Rumors and misinformation spread via social network services, and they increased people's perception of MERS. In addition, by affecting the people's trust in the government, it resulted in increased mistrust and non-cooperation with the government's response policy. According to a public opinion poll, 70% of respondents showed disbelief in the government's MERS policy in 2015. Taking lessons from MERS, the Korean government has been preparing for new risk issues. It revised the risk communication manual and trained its people extensively on appropriate responses in risk situations. Thanks to this preparedness, the Korean government successfully managed COVID-19 this year. According to the poll, more than 50% of Korean people evaluate that the government responses to the coronavirus pandemic was satisfactory. As a conclusion, here are key lessons in communicating during COVID-19 outbreak. Preparedness is important in handling a risk and emergency. One important part of the reason for Korea's success in managing COVID-19 is because we experienced similar epidemics before, such as SARS and MERS. When MERS hit Korea in 2015, the government's risk management was not successful. However, this painful experience really moved the Korean government to prepare for potential risks that can happen anytime. And when COVID-19 occurred in China, the Korean government quickly started communicating about the risk. Audience segmentation and delivering messages targeting each segment is critical. The Korean government carefully developed and aligned messages for each target audience, including the elderly and young children. Take-on action message needs to be simple and easy. And remember the 6 principles of crisis and emergency risk communications. In particular, in Korea, the 2 principles, be first and be credible, were well implemented, and they turned out to be effective. Communication is critical to the crisis response. Communication planning before the crisis needs to be done, and regularly monitor the crisis preparedness. This is the end of the presentation. Thank you for listening. Best wishes wherever you may be in the world.